So let's speak about facial nerves block, and then after that ear block. Facial block, we have three nerves. Okay, we have the supraorbital nerve, we have the infraorbital nerve, and we have the mental nerve. Supraorbital nerve, usually it emerges from the supraorbital foramen. Supraorbital foramen is supraorbital foramen. You can feel your supraorbital foramen. It's here in the mid-pupillary point. In the mid-pupillary point. Okay, that's about 2.5 centimeters from the midline. This is the supraorbital foramen. You can find it. Okay, you can feel it. All right. So this is where I would like to inject my local anesthetic then. Okay. It provides supraorbital and supratrochlear nerves. Supratrochlear nerve coming from the medial part, upper part of the ethmoid area, which is medial upper part of the orbit. It's from there. So supratrochlear nerve provides sensation to the medial part of the ipsilateral part of the forehead. Okay, the medial part. Supraorbital nerve provides sensation to the whole remaining part of the forehead ipsilaterally. All right. So how to inject? There is multiple techniques, but easy one is to get from the midline. Okay, at the level of the upper border of the eyebrow, and then move laterally about 2.5 centimeters near the supraorbital foramen. Okay, and then give subcutaneous infiltration 3 to 5 ml of your lidocaine, but don't exceed the maximum dose. And try to avoid injecting inside the supraorbital foramen, because if that happened, the local anesthetic might get to the optic nerve and cause temporary blindness. And that will provide an anesthesia for both supraorbital and supratrochlear nerves. So all the ipsilateral part of the forehead. Now let's move to the infraorbital nerve. Infraorbital nerve, again, it emerges from the infraorbital foramen, which is just below the inferior orbital floor. Here, you can feel your infraorbital foramen. Again, this is 2.5 centimeters from the midline at the level of the mid-pupillary imaginary line. So there is something called mid-pupillary line. That's a line which just crosses the pupil on that side. Okay? How to give that? There is multiple approaches. There is extraoral or intraoral approach. We will now discuss the extra oral approach. We will inject just below here, 45 degrees. You will insert your needle and get deep until you touch the bone just below the infraorbital foramen. Alright, and then aspirate and then give 3 to 5 ml of local anesthetic. That will anesthetize the whole part from the lower eyelid and the cheek and the ipsilateral half of the upper lip. Alright, so any procedure there, infraorbital nerve. Then the mental nerve. Mental nerve, again, it comes out from the mental foramen there. Again, it lies 2.5 centimeters from the midline. All right, so at the mid-pupillary imaginary line, there is multiple approaches. The lateral approach is easy. You will inject from here, getting like 45 degrees, medial and deep until you hit the bone, and then aspirate and then give 3 to 5 ml. All right. and that will anesthetize the ipsilateral half of the lower lip and the chin as well, ipsilateral half. All right, this is the facial nerves block. Again, 3 nerves: supraorbital nerve and the trochlear nerves, supraorbital and supratrochlear. All right, and then infraorbital, and then mental. Now let's speak about the ear block. Thank you. We have 3 nerves. Okay. We have the greater auricular nerve, the auriculotemporal nerve, and the lesser occipital nerves. Greater auricular nerve, lesser occipital nerve, and auriculotemporal nerves. If you would like to do any procedure in the ear, any procedure, then the greater auricular nerve, you will give subcutaneous infiltration about 1 centimeter below the ear lobe. At this level, horizontal subcutaneous infiltration. Okay, you will block this area. That will block the the greater auricular nerve. The lesser occipital nerve passes behind the ear. So subcutaneous infiltration vertically about 1 centimeter posterior to the ear. Okay, auriculotemporal nerve, this is passes anterior to the tragus. So we'll give subcutaneous infiltration vertically like 1 centimeter anterior to the tragus. So now we provided complete ear block. Thanks. Okay, so now let's see how to perform the wrist block. Okay, we will block the median nerve, ulnar nerve, and radial nerves. The median nerve lies between the 2 tendons of flexor carpi radialis and palmaris longus. So here, inject at the level of the proximal wrist crease. This is the proximal wrist crease. All right, this is the proximal wrist crease. So get deep injection. You will get like 1 centimeter or something like that inside, and aspirate first and give 3 to 5 ml of lidocaine. And then this is the median nerve. Ulnar nerve. The ulnar nerve lies just below the flexor carpi ulnaris tendon, between the tendon and between the ulnar artery. Okay, so you might come from from medial approach. You will come from here and inject just below the tendon, and you will be very near to the ulnar artery. So aspirate and then give 3 to 5 ml. That's for ulnar nerve. Is that clear? Clear?
Yes.
Mm-hmm. Then let's come to the radial nerve block. This is superficial infiltration. So you will start from the outer border of flexor carpi radialis, all right, from here, and you will inject subcutaneously infiltration until you reach the distal radioulnar joint on the dorsum of the wrist. So it will be like that, subcutaneous infiltration. This is the wrist block. All right? Good. Now let's discuss the digital block. This is very, very common. Someone come with maybe wound in any of the fingers, maybe with dislocated finger, any procedure, abscess, drainage on one of the fingers, baronegia, aspiration, all of these are indications. All right? So let's say we would like to block the index finger, for example. There is many approaches, all right? But it's always better to inject from the dorsum of the hand, because this is less painful. From the palmar aspect, very painful, okay? So what we need to do is locate the metacarpophalangeal joint, and then just distal to it, because you don't like to inject inside the joint. Just distal to it. You will come from the side of the finger, okay? From here, from the side, one injection, and from the other side is one injection. So I will use lidocaine, for example, 1% or anything without adrenaline. And then you will get from here and go until you touch the skin in the palmar aspect, but don't pierce it. And then stop, okay? And then aspirate, no blood, give 1 ml of lidocaine. And then come out, but don't get out completely. When you are near the skin on the dorsum aspect, stop, aspirate, no blood, give another 1 ml. Get out. And now go for the other side, and the same, pierce the skin and go until you touch or near the skin to the palmar aspect. Stop, aspirate, give 1 ml, and then get out, and when you are near to exit, stop, aspirate, give 1 ml. So this is total of 4 ml, okay? That will provide block for your procedure, all right? Make sure to calculate the maximum dose that you can give always, okay? Even if you are planning to give a small amount of local anesthetic, make sure to calculate. For this is 3 milligram per kilogram for the lidocaine, or 7 with adrenaline, which you are not going to use in this patient because this is in the finger, all right, for the risk of causing ischemia, necrosis, and loss of his digit, all right? This is the nerve block, which is very common station in the exam. This is easy one, all right?
So you are first?
Yeah, so sometimes someone going to the exam and doing the nerve block, he's very happy that he did it well, and then scoring like 2 or 3, because you did not speak about the indications, contraindications, complications, treatment of complications, preparation, procedure, and post-procedure care. You need to go through all of that to get high mark, otherwise you will not. All right, now let's go to the ankle block. Yeah, so the hematoma block, as we said, this is the hematoma indication for any for distal radial fractures, manipulations. Okay, so you are going to use lidocaine, the IV formulation, and better to use ultrasound guided as well. You will look at the junction between the proximal and distal broken parts of the bone, and then you will get 45 degrees, all right? You will be inside the hematoma until you are between the 2 broken pieces. Aspirate, blood will come because this is hematoma anyway, and then inject 10 to 15 ml of lidocaine, but don't exceed the maximum recommended dose per body weight. All right, that's how to perform the block. Then make sure the procedure and the manipulation has been done, and cast and X-ray and everything. Okay. Fine. So already we have discussed the indications, contraindications, complications, the general approach to the nerve blocks. So now we are going to just mention the indication and how to perform the block for every particular nerve group. So now let's speak about the ankle block. The ankle block. Ankle block, we have 5 nerves to block. All right. We have the deep peroneal nerve. The deep peroneal nerve. Okay, at the level of the ankle. Can you extend? Okay, as I did here, just your big toe, extend it here. All right. So this is extensor hallucis longus, and this is tibialis anterior. Okay. So extensor hallucis longus. Okay, will jump out, and tibialis anterior tendons. Between the two tendons, you will find the deep peroneal nerve, about 1 centimeter deep, at the level of the anterior part of the ankle. This is the landmark. Okay, you are going to inject a deep injection about 3 to 5 ml. All right. We need to block 5 nerves, so make sure you calculate the maximum dose of your local anesthetic before starting that. Then the deep peroneal nerve provides sensation to the web space between the big toe and second toe. Then now we will go for the superficial peroneal nerve. Superficial peroneal nerve. This is subcutaneous infiltration. Subcutaneous infiltration. Okay? Come here, please. Come here. Come here. Superficial peroneal nerve will start subcutaneous infiltration starting from the lateral aspect of extensor hallucis longus tendon up to the lateral malleolus. So I will give you just subcutaneous infiltration, all right, until here, okay? And that will provide, you will block the sensation over the dorsum of the foot, okay? All of the dorsum of the foot. This is the superficial peroneal nerve. Now, let's go to see the surreal nerve. All right, surreal nerve. It lies between the Achilles tendon and the lateral malleolus. So this is again subcutaneous infiltration, just under the skin, subcutaneous infiltration, and that will block the heel. That will block the heel. Only the heel, maybe the lateral aspect of the foot as well. All right, the dorsal part. Okay, so this is the surreal nerve. So that will be blocking this area here. Okay. Okay, and now let's move to the other side. This is the tibial nerve, which lies between the medial malleolus and the Achilles tendon. Okay. Feel for the posterior tibial artery palpation, and then the injection will be between the posterior tibial artery pulsation and the Achilles tendon. This is deep injection. It's not subcutaneous infiltration. Deep injection. Just posterior to the posterior tibial artery pulsation. And you will give 3 to 5 ml. Okay? To block the tibial nerve. Tibial nerve actually provide blood supply to the anterior part of the sole. Okay? So it will provide to all this area. So actually the tibial nerve divides into medial and lateral plantar nerves. Medial and lateral plantar nerves that provide sensation to the anterior part of the sole. So anterior part of the sole with tibial nerve sensation, and the heel of the foot with surreal nerve. Okay. Now the fifth nerve is the saphenous nerve. Saphenous nerve lies just above and anterior to the medial malleolus, going along the great saphenous vein. So the saphenous nerve is here. Typically, you will give your subcutaneous infiltration around this area. So this is anterior and little bit above the medial malleolus. 1 inch anterior, 1 inch above. All right, and that provide sensation the saphenous nerve to the medial part of the foot. If you notice that we have 2 deep injections and 3 subcutaneous infiltrations. The 2 deep injections are for deep peroneal nerve and tibial nerves. The rest by subcutaneous infiltration.